Yeah, yeah, la, la, la.
Hi, welcome to my channel. Um, I'm taking part in the Dudu challenge in honor of all cancer survivors and anybody battling cancer, especially breast cancer. This month, October, being the Breast Cancer Awareness Month, I want to stand with everybody that is battling breast cancer and remind you that you're not alone. You are strong and you are going to pull through this. And I love you. In my video today, I want us to talk about breast cancer. A few things you should know about breast cancer. Firstly, what is breast cancer? That's just a form of cancer that forms in the cells of the breast. So it's abnormal growth of cells in the breast. That's basically what breast cancer is. In Zambia, it's actually the second most common cancer among women. Breast cancer, that's after cervical cancer. Breast cancer is not only limited to women, even men can get breast cancer. Of course, the percentage of women that get breast cancer is higher than that of men, but in every 10 breast cancer, you would have one male breast cancer patient. So what are the signs and symptoms of breast cancer? Breast thickening or lump in the breast, change in the size of your breast, shape or just basically appearance of your breast, change of the skin around your breast, and dimpling starts going in, redness or swelling, or even an inverted nipple. Those are signs that should not be ignored. In case you observe any of the signs, make sure to visit the hospital. What causes breast cancer? Well, the cause is not really known, but it's a complex interaction of your genes and your environment. So they're just what are known as risk factors, so factors that could make you more prevalent to getting breast cancer. Now, what are these risk factors? Being female. Just by being a woman, you're more likely to get breast cancer, but that doesn't mean a man cannot get breast cancer. Age. As you grow older, your chances of getting breast cancer are also getting higher. Personal history of breast conditions. So in case you've had any breast condition, like lobular carcinoma in situ or atypical hypoplasia of the breast, this could increase your chances of getting breast cancer. If you've had a history of breast cancer before, the chances of getting breast cancer in the next breast are also high. Family history of cancer, breast cancer, particularly say your mother, your sister, your child, also increases your chances of getting breast cancer. Inherited genes. There are some genes that we inherit that could also predispose us to having cancer, like the BRCA1 and BRCA2 genes. Radiation exposure. In case you've had radiation to the chest before, you're more prevalent to getting cancer, so your chances of getting cancer increases. Obesity. So obesity is also a risk factor of cancer. MENAC, which is simply beginning your periods too early, say maybe by 12 years old, that it also predisposes you to having cancer, breast cancer in particular. Having your first child at an older age, that's above 30 years old, your chances of getting cancer increases. Having never been pregnant before, which is why we see a lot of nuns get breast cancer. It's because of having never fallen pregnant before. That increases your breast cancer chances. Postmenopausal hormone therapy. There's some hormone therapies that are given to women that are postmenopausal. That increases also their chances of getting breast cancer. And alcohol. So taking alcohol is also a risk factor. How do we prevent breast cancer? Some prevention methods we could use are breast cancer screening. Like this is October here in Lusaka, particularly at Cancer Disease Hospital. We offer free screening for breast cancer for all women and men. So anybody is free to walk into Cancer Disease Hospital and be screened. So yearly at least you could screen. Another way to prevent breast cancer is become familiar with your breasts. Do self-breast examinations regularly. We also teach those at Cancer Diseases Hospital, especially in October. We have people dedicated to you to teach you just how to self-examine your breasts. Drink alcohol in moderation, so at least limit the amount of alcohol you take, if at all you take alcohol. And also limit postmenopausal hormonal therapy, and maintain a healthy diet and weight. These are just things that we could do to prevent. But that is not saying in case you do all these things you may not get breast cancer. You could still get breast cancer, but just that your chances are lower. We also have some risk reduction strategies for women that have high risk of getting breast cancer. Some women will be will decide to be put on preventive medications, which are estrogen blocking medications, such as selective estrogen receptor modulators and aromatase inhibitors. Or some women will decide to have preventive surgery. This is just where you actually do a surgery without testing positive for cancer, but because you have the cancer genes, you decide to attack it before it actually attacks you. Thank you for listening in, and just a reminder, this is October. It's Breast Cancer Awareness Month. We have free breast screening at Cancer Disease Hospital. Please remember to pass through. It's free. The staff are friendly. You're going to get a good booking, and you will know the status of your breasts. Take care of your babies. Bye-bye.